Has about 22 bones in it. The skull does have sutures, so this is one of those places where wormian bones or sutural bones come into play. All the bones are interlocked along sutures, except for the lower jaw, the mandible. It's the only movable joint in the head. In the skull, not the head. The skull is the cranium and the facial skeleton. The cranium has 8 bones and encloses and protects the brains, while the facial skeleton has 14 bones that form the shape of the face. So the orbit contains both cranial and facial bones. That's where your eye is. There are paranasal sinuses in both cranial and facial bones. Those are spaces that lighten the weight of the skull. Help with sound resonance. For the frontal bone, the cranium, we have the forehead, the roof of the nasal cavity, roof of the orbits, the frontal sinuses, and the supraorbital foramen. Important features of the cranium. On the parietal bones, shown here in purple, we have the sides and the roof of the cranium, the sagittal suture, and the coronal suture. Those sagittal and coronal should remind you of planes we discussed earlier in the year. On the occipital bone, which makes up the back of the skull, we also have the base of the cranium, the foramen magnum, where the spinal cord is going to come out, the occipital condyles, and the lambdoid suture. Temporal bones make up the sides and the base of the cranium. They're floors and sides of the orbits. They have the squamous suture, the external acoustic meatus for the ear or the ear canal, the mandibular fossa, the mastoid process. There is a styloid process in the cranium. In fact, we will see the term styloid process in several different bones. It's a structure that sticks out and looks kind of like the end of a pen. That's where it got its name. There's also the zygomatic process and the zygomatic arch. The sphenoid bone is at the base of the cranium and makes up sides of the skull. It's the floors and sides of the orbits. It has the sella turica and the sphenoid sinuses. Ethmoid bone is in front of the sphenoid bone. It's the roof and walls of the nasal cavity, the floor of the cranium, the walls of the orbit. This is where we have cribriform plates, which will become important when we talk about the sense of smell, the sense of olfaction. The perpendicular plates are there, as well as the superior and middle nasal conchae. Ethmoidal air cells are found in the ethmoid bone. Ours are crista galli. Sutures are those major joints between the bones of the skull in the cranium, and there are 4 major ones: the coronal, the sagittal, the squamous, and the lambdoid. The maxilla is the maxillary bones, and there are 2 of those. It makes up the upper jaw. This also makes up the anterior roof of the mouth, the hard palate, floor of the orbits, side and floor of the nasal cavity, alveolar processes, maxillary sinuses, and palatine processes are important in the facial skeleton. The palatine bones, of which there are 2, they are L-shaped bones located behind the maxillae, the posterior section of the hard palate, and the floor and lateral walls of the nasal cavity. The zygomatic bones, of which there are 2, are the prominences of the cheek, the lateral walls and floors of the orbits, the temporal process in the zygomatic arch. We also have 2 lacrimal bones, which make up the medial walls of the orbit and have a groove from the orbit to the nasal cavity, which will be the canal that's used for tears. And the nasal bones will make up the bridge of the nose, and there are also 2 of those. Our vomer bone is called the vomer bone because it's German for plow, and it's shaped like an old-time plow. It's along the midline of the nasal cavity, below a portion of the nasal septum. The inferior nasal conchae are scroll-shaped bones that extend from the lateral walls of the nasal cavity, and they are the largest of the conchae. The mandible is the lower jawbone. It's a horseshoe-shaped body with structures on the side called rami or ramus. There has the mandibular condyle, the coronoid process, the alveolar process, the mandibular foramen, and the mental foramen. And in an infantile skull, just before birth and for several years after birth, we do have fontanelles, which are commonly referred to as soft spots. These are fibrous membranes that contain cranial bones, and these are locations where that intermembranous ossification is not finished, and that allows some movement on the skull through the birth canal. And we'll end it here.